In this video, I will be exposing 3 fertility doctors to avoid in 2023. If you're new to my channel, I am Dr. Amarachi Ijeoma. I am a fertility physician and my channel focuses on everything women's health and fertility. So if this is the kind of content you're interested in, keep watching. Number 1, TTC Groups on social media. TTC Groups are trying to conceive groups on social media, especially Facebook. The things that my eyes have seen on these groups, if I do not talk about them, I'll be doing you guys an injustice. Before I start, I must acknowledge and commend the TTC groups on Facebook that actually help couples in navigating their fertility journey. But the ones I'll be talking about today are the scammers in those groups and the TTC groups with thousands of followers that are owned by a doctor. And I put the doctor in quotes because people on social media abuse the doctor title. They are not necessarily licensed as doctors to actually call themselves doctors, but they use that in order to scam innocent people and desperate people that are looking for solutions to their problems. So I'm going to be reading out a lot of these advices and I'm going to be putting what I'm reading on the screen, but I'll be reading it out from my phone. So I'll be reading from different groups. So on this group, a member posted, "I'm 40 and I'm trying for a baby, but it is hard. Please help." And someone responded, "Try Get Pregnant Fertility Tea. It will help you a lot in conceiving at this age. I saw too many women in their 40s who tried and got conceived. Check out a website where they sell fertility tea." So here's the thing. What exactly is fertility tea? What studies have been done on fertility tea? What are the components of fertility tea? This woman is 40 years old. What is her history? What do we know about her? Shouldn't you be advising her to do a full fertility workup and advise her to be on prenatal vitamins and to go for a fertility consultation so that she can optimize her chances of getting pregnant at age 40? So if you continue to listen to random people on social media that tell you about fertility tea without you doing your investigations or talking to a professional, what could happen is it's like you're on a journey and your destination is right in front of you, but you're taking a detour because you're trying out other things. So even if in the end you still get to your goal, you are taking time out from actually getting to your goal at a particular time. And while doing that, you can actually meet some hurdles along the way, because depending on the advice that you take, it might be detrimental to your health and it might take you steps backward from your journey, from your goal. So be careful what information you receive on social media. Be careful of social media doctors. I'm going to be reading another one. Remedy for missed periods. For those that have missed their periods or having irregular periods and are seeking natural ways to bring their periods back, try this. Don't go to early menopause. Ingredients: garlic, ginger, turmeric, lime, alligator pepper, gin. The process: crush the garlic, ginger and 7 seeds of alligator pepper. Cut 2 limes into 2. Put everything in your bottle and add the gin to it. Allow to stay overnight. Take 1 shot morning and night for 3 days. You will testify. Okay. First of all, this sounds like a Nollywood movie where you're advised to get the tooth of a snake, the hair of a tiger, and the skin of a crocodile. I mean, it's the whole process for me. When she was talking about garlic, ginger, turmeric, I was really feeling it because they're all, immunocompetent, natural ingredients, okay? Lime, gin. She lost me at gin. Number one. These ingredients she called minus gin apparently are all healthy ingredients. They are part of our daily diets that we eat normally, that is good for our health, which is a good thing. But she lost me at gin because gin is alcohol, the last time I checked. And when you're trying to get pregnant, you should actually stay away from alcohol as much as you can. It's not like you should absolutely stop taking alcohol, but as much as you can, you should reduce the amount that you ingest. Now, this process is saying take it morning and night. So we're taking the gin morning and night, and we are trying to get remedy for a missed period. What is a missed period? A missed period is when you don't see your period on the day you're supposed to see it, and then you've waited 5 or more days and you still don't see the period. That's a missed period. One of the common causes of a missed period is pregnancy, but other things could actually cause a missed period. It could be stress, it could be low body weight, it could be obesity, it could be PCOS, it could be that you're on birth control, it could be premature ovarian insufficiency, it could be anything. So when you want to remedy somebody from a missed period, you should at least try to find out, why did this person miss her period? You evaluate the person, you do some investigations, you check for so many things before you can tell what the reason for the missed period is. Then you now remedy it. So just giving a random general remedy for missed period. The second group of fertility doctors to avoid are social media vendors that sell magic drugs, magic pills, or concoctions like magic drinks that are supposed to be able to cure blocked tubes, infertility, gonorrhea, chlamydia, syphilis, everything. You have to avoid these set of doctors. No one pill can cure everything. Blocked tubes has its own treatment, and there's no pill involved in treating blocked tubes. If you want to treat blocked tubes, it depends. How are your tubes blocked? Do you have hydrosalpinx, or do you just have a blocked tube? Hydrosalpinx is when there's water in your tube. Then a blocked tube is when there's no opening in your tube, okay? The tube is closed, is blocked. And then that same pill, that same drug is supposed to cure gonorrhea, syphilis, infertility. I mean, what is the cause of the infertility? If it could actually cure infertility, shouldn't you try to find out what is causing the infertility first before treating the infertility? So just going to get a magic pill from a social media vendor that has thousands of followers, hundreds of thousands of followers, does not necessarily mean that that doctor is legit or that person is a doctor. Most times they are not doctors actually. And most times these vendors will say, this is a pill that your doctors don't want you to know about. When you hear this, that's a red flag, because we don't hide pills from patients. We don't hide solutions from patients. Our job, literally, is to give solutions to patients. So when you hear a vendor say that, they're just trying to sell their markets. The third group of fertility doctors to avoid this year are those ones that by the time they give you their address, the direction to their office, it's very suspicious. Before you know it, you're entering a path that is just inside a bush. Sometimes it might not even be just the direction of their offices. It's the content of what they tell you. You know, when they tell you that, okay, if you want to have one baby, we can help you. If you want 2 babies, we can help you. If you want 3 babies, we can help you. No doctor, and there's no way you can be able to say, like, you absolutely will have 2 babies when we do a treatment for you. There's no way to tell, there's no way to predict that. So when you see a fertility doctor that tells you, for 1 baby you pay 1.2 million naira, for 2 babies you pay 2 million naira, you know, that is a red flag. You have to look out for that, and you have to run, be on your heels and run, because the next thing you'll be hearing is that, oh, the pregnancy is a cryptic pregnancy, and this is popularly a scamming method in Nigeria, especially the eastern Nigeria. A few places in Lagos, but mostly the eastern Nigeria. You have to look out for these red flags. What would they tell you when you get there? Usually the first thing they will give you is something to put into your vagina that is usually very harsh. And remember that you shouldn't put anything harsh, anything at all, into your vagina. So that's the first thing they will do, because they'll say they're trying to cleanse your vagina and all of that. Then the next thing they will do is to tell you that you shouldn't go to a hospital or a lab to do an ultrasound scan, because the gel that will be used on your belly can harm the baby. This is not true, because the gel used for ultrasound scan cannot harm the mom or the baby. Then some of them will tell you, if you go to the lab or if you go to a doctor to do the scan, they won't be able to see the baby because it's a cryptic pregnancy. So all these are scams. Most times these women end up carrying the pregnancy more than 9 months, okay, because it's not real. They are trying to get the baby from wherever they are getting the baby from. So what they tell you is that it's because it's cryptic pregnancy, the baby is growing slowly. So sometimes you might actually be pregnant for up to 2 years. Like, not pregnant obviously, but you know, doing the process for up to 2 years. They'll be giving you medications to make you add weight, some hormonal medications that will make you add weight and all of that. and that will make you stop seeing your period so that you can believe it more. Then when it's time to give birth, they will schedule you for a cesarean section, fake cesarean section, where they will actually make an incision on your belly, on your abdomen. They will put you on anesthesia so that you would be unconscious, and then they will make an incision on you, fake cesarean section, stitch you back up, and then when you wake up, voila, you see your baby or your babies. Then you start to suspect when it's time to breastfeed the baby because you're not producing breast milk, because you were never pregnant. So these are the set of doctors to look out for. What is the real cryptic pregnancy? Cryptic pregnancy is actually a thing. So cryptic pregnancy is when a woman doesn't know that she's pregnant till she's in labor, till it's time to give birth. It sounds absurd, but it does happen. It's rare, but it does happen. What are the cases where we see cryptic pregnancy? One, in women on birth control. Sometimes birth control is not 100% accurate. Most of them are greater than 99% accurate, but it's not 100. So because they're on birth control pills, they believe they can't get pregnant. So when they actually get pregnant, if the birth control fails, which is rare, they will not believe that they're pregnant. They will just think, especially if they don't now have like the major pregnancy symptoms, they will just think, oh, they're just a little bit tired, they just think it's a normal this thing. So this further reduces the suspicion rates when they are pregnant. Another cause of cryptic pregnancy is women that naturally don't have regular periods. So if on a normal day they see their periods 3 times in a year, when they actually get pregnant, they will not know, because in their minds they're like, oh, it's a normal thing. I go 8 months in a year without having seen my period. So they would not know that they're pregnant. Yes, their belly starts to show. They might just think they're adding weight, because in their heads, this is a normal thing for me. For some women, they took a pregnancy test and it showed negative. Either they did the pregnancy test too early or there was error with the pregnancy test. So ordinarily, they will believe that they are not pregnant because the pregnancy test said no pregnancy. So they just believe that, oh, maybe I'm just adding weight. So they might not know that they are pregnant till it's actually time for labor. I know this is rare, but it happens. Very rarely, but it happens. Or they've been diagnosed with infertility and told they can never get pregnant. So when they get pregnant, they wouldn't believe that they are pregnant because they would just think, oh, especially if they are not adding weight. Some women don't add weight and their baby bump does not show till very late in the pregnancy. So it's easy for them to just not know that you're pregnant till it's time for delivery. So yes, cryptic pregnancy is rare, but it does happen. But not in the way that scammers in the eastern part of Nigeria have made it out to be. So beware of these red flags when going to see a fertility doctor. If you have found this video informative and you want more videos like this, subscribe to my channel, like this video, drop a comment below, and see you in my next video.